Would you know what to do if your child was choking? What if he or she swallowed pills or had a minor burn? A new survey finds that many parents are confused about when to go to the emergency room.
And as you're about to see, even a highly skilled doctor had trouble thinking clearly when it came to the life of her own child. Mike Ferris has our special report.
What we're going to do is I want to take a look and see what we need to do for her.
In the Children's Hospital emergency room, Dr. Jerusa Aita Levy treats very sick babies and children, saving lives for nearly 20 years. But with all of her medical training, teaching, and years of hands-on experience,
So Eli, what do you have for homework?
she was not prepared when her own precious child was in a race against the clock for his life.
And I'm thinking, God, please save my child. Please let my child live.
It was years ago when her 7th grade twins were 4. One of their 2 older brothers was playing soccer. Gabriel and Eli were on the sidelines playing in the grass. After the game, Eli complained he was hurting and itchy.
And I'm like, you're fine. You're rolling on the grass. It'll be fine. I'll get you Benadryl. We're all set.
Soon hives followed on his body, and he became anxious in his car seat.
And I said, no, calm down. It's okay. I'm going to get you Benadryl. We're like 10 minutes from the house.
But then, acute onset of runny nose, coughing, difficulty breathing. When he got home, he collapsed on the sofa, lethargic and wheezing.
In that moment, I thought, oh my God, I think this could be an anaphylactic reaction.
Anaphylaxis is a serious, life-threatening allergic reaction. Without immediate medical treatment of an injection of epinephrine, it can be fatal. Without treatment, 50% die in the first 30 minutes, 75% in the first 4 hours. 15 minutes had already passed since Eli left the soccer field.
And time was of the essence. And I was just praying, God, please don't let my son die.
Her mind was racing with options. Call 911, go to the nearest ER, call her husband. Dr. Aita Levy drove like mad to the nearest pharmacy. Eli's twin, Gabriel, was in the car too, petrified.
All I remember is saying to my mom, hurry, mommy, hurry.
Hurry, mommy, hurry. He's my best friend. He's my best friend.
She was lucky the pharmacy had an EpiPen in stock, but still, she had to say she was a doctor and write a prescription for it before it was handed over. Then, more panic.
Because I know how to dose it, I know when to give it, I know the signs, but I myself have never administered an auto-injector to anyone before.
A crowd gathered, the pharmacist hands her the instructions.
I am in a full pool of tears. I don't know how to read, the letters don't make any sense, and I heard a voice. Get a grip, get a grip.
Eli gets the shot in his thigh and instantly gets better.
And Eli took a deep breath, and I just remember he saying, I feel better, mommy. And Gabriel turns to his brother and says, good job, Eli.
Dr. Aita Levy tells her most difficult story because it's important for parents to know when you must go and when you don't have to go to the ER with your children.
I would say it's very common. It's a really complicated question and a hard decision for a lot of parents to make. There's a lot of parents who end up making the choice to come to the emergency department when it may very well be handled by their pediatrician in the office the next day.
LSU Health's Dr. Anna McFarland specializes in emergency medicine and pediatrics and works with Dr. Aita Levy in the Children's Hospital ER. She says there are some guidelines. Fever, colds, and rashes in older children can wait, but infants should not.
Any baby with any fever, so 100.4 or above, who is less than 3 months old, probably needs an evaluation sooner rather than later. Certainly a baby in their first 2 months needs to get to the ER with a fever for an assessment.
Tylenol or Motrin can help older children with fever, but go to the ER if symptoms or rashes progress to the full body, if there's acute vomiting or diarrhea, especially with blood in it, if children are no longer urinating, or if there's trouble bleeding.
Most rashes probably don't need to come to the emergency department. Those that do would be worrisome for allergic reactions, so rash plus something else. Rash plus trouble breathing, rash plus vomiting, rash plus high fever.
Good rule of thumb, is your child still eating and drinking? Can he put weight on that twisted ankle? Those can wait for the pediatrician's office. But with belly pain that's getting worse, bring them in.
It's not uncommon for us to have 2 or 3 appendicitis a day. It is the most common abdominal emergency as far as surgical emergency in a child by far.
Dr. McFarland says call poison control for swallowing any liquid or solid objects. Otherwise, the best advice when in doubt is to call the doctor for advice. That's exactly what Sarah Babcock did.
I was wondering with rapid breathing, so I called a friend who's a physician. He said, watch it if it continues to get worse, to go to the ER. And his cough started to get bad that he looked like he was about to vomit. He was coughing so hard. So that's when we made the decision to come to the hospital.
Sarah is a first-time mom hoping to legally adopt her toddler foster child. He has asthma made worse from smokers in a previous home. She makes sure to get advice for the new, most beloved person in her life.
I decided I was ready to be a parent. Sorry. They just help a child in need.
For Eli, the culprit was one tiny fire ant bite on his knuckle. Treatments of venom injections lowered Eli's chance of having another reaction. EpiPens are kept everywhere he goes, but parents in this situation call 911 since EMS has EpiPens.
I asked my mom, said, what would happen if you didn't give me that shot? She said, well, you would have died. I said, thank you for saving my life.
It was not until the allergist then told me, you saved your child's life. I cried for hours, yeah.
Meg Farris, Eyewitness News.
And one more important tip, doctors say if a child is choking, there is no time to wait for EMS. Parents need to both learn and use the Heimlich maneuver.